One next to it is also very loose, so I'm going to take that one out. Go around it with this tool to elevate the tooth and detach it from all the tissues. And then once it's loose, we use this to remove it. And there's the whole root. This tooth definitely has some pocketing, and on the x-ray we can see there's some pocketing. It's not quite ready to be extracted, but it's one we're going to definitely monitor and make sure that we know to come back and look at it next year. Other than that, I think she's good. So it's just the incisors on the top and the bottom. We shoot an x-ray of those and then we can close.
All right, so we are getting x-rays because we need to make sure that there is no roots remaining. Remaining root can be a problem if, of course, the mouth is diseased or has any kind of issues. It may not be an immediate problem, but it can be at a certain standpoint throughout the life. It can be a problem. There are some dental experts that leave the roots in, but we like to remove them. Shooting. And then we wait for the x-rays to come back. As you see, there is no teeth here. We look in this area for roots. As you see, there's roots here going here, but there's none here. So that spot is clear, so we can go to the next spot. When manipulating a pet that has a tube in its mouth, you need to move the pet very carefully. You never want your hand in front of that beam. Only what you're aiming at is in front of the beam. Shooting. Little beep. And boom. That one. And then the next one.
The area of the tooth that we extracted, and we don't see any roots in there. Yep. So that's the other one. Looks great.
Hi, Daisy. Hi,